live. We've got new language that we're gonna look at.
Oh, this is
Refresh, if you refresh, you'll get new language. Um,
the social workers thing that we talked about yesterday.
the social worker thing that goes on to,
Those 10,000 issues ago.
No.
this goes on to 189, which is the, we're back. This is Senate Health and Welfare. We're looking at a request that has come to us from the Social Work, Association of Social Workers. And we have Lynn Courier Stanley here with us to offer comment. And we also have a proposal that Katie drafted based on her conversation with the organization as well as the advocate for the organization. So Lynn, welcome. And there you are. Why don't you share with us your thoughts?
Thank you. And thanks to the committee for inviting me today. And for the record, yes, my name is Lynn Courier Stanley. I'm the executive director for the National Association of Social Workers Vermont chapter. Back this summer, I was approached by the partner of Leah Rosen Pritchard, the social worker who was killed by one of her clients this past spring. Urging me is there something that we can do? Leah's death was the second social worker death in the last 8 years. And obviously other injuries that haven't received the attention that a death does. We know what the problem is. Social workers and those in providing social services have some of the highest rates of injury and death in the United States. So we know that is the problem. What we don't know is the problem behind that problem and where some of the solutions might be. That's why we're asking for this group to be formed. We are very ready, willing, and able to take the lead on it, to dive into the research. And there is plenty of research out there, and look at where some of the barriers are to making the work that we do just a little bit safer. We're not sure where that problem lies right now. Is it in training? Is it in resources? Is it in technology? And that's over the course of a few meetings, we hope to be able to pinpoint and then come back with a presentation that will outline not only our process and who is involved, but our recommendations. And I'm happy to answer any questions that you might have.
Thank you for that. That's terrific context. And I know we've had the horrible incident in Brattleboro for a young woman. And so this will be helpful in moving forward to figure out how we can prevent things like that. If you have I would be great to have your testimony in writing, send it off to Kiki. Do we have it? Okay, good.
Yes.
Great.
Yes.
Thanks. That's great. We have language in front of us that we're not going to share on the screen at this time. We've just received it from our legislative council. And I'm thinking that you have seen it. Have you seen the latest draft or not? But I will share with you a little bit about what it says, because I know there was some disagreement about who's in charge and how it happens. But it does have the Agency of Human Services convening the group, initially in consultation with, in collaboration with the Vermont chapter of National Association of Social Workers. That means you would be in charge, I would think, of this group. And then the list of folks, the Vermont Network Against Domestic and Sexual Violence, the Vermont Coalition to End Homelessness, mental health and healthcare providers, community action programs, restorative justice center service providers, disability service providers. So that's the group. And that's the group that you were looking for.
Correct. So we will open it up to any and all who would like to be heard.
So my question is, we're not putting limitations on meetings. That's not something that you asked for. We cannot provide, we can't provide support for this. But you will have, the Agency of Human Services somehow involved in collaboration with you to help present the report, the information that you glean. My question, as I look at this, is don't we also need to have a date certain by when the first meeting shall be convened? The group shall be convened. And I'm asking you that question.
Thank you for the question, and give me a moment just to mentally calculate my calendar. I would it's my hope and intention that it would be started in the summer, but let's say that the first meeting will convene no later than the middle of September, though that would just be the latest date, correct?
Well, yeah, so ordinarily what we do is we put a date in such as August 15th or September 1st. And then if it looks like things can't happen until September 10th, you can reach out and say, we can't meet till September 15th or whatever, and usually the chairs of committees or others of the agency will say it's okay, it's not, but I think having an earlier start date will help with your completion of all the work that's involved here and getting all of those people together.
Thank you for that. Then can we set a date for August 16th? That's a Friday.
All right. I'll see how that goes. All right.
Can I just ask you something?
Yeah, go ahead.
Is the language you're looking at, the language that's on our website says the Department of Mental Health, not the agency?
No, there's a new one.
There's
Katie,
another
you
new
post
one?
a new one from Katie?
Oh, it's from Katie. It's from Katie.
Yeah, no, we're not, the Department of Mental Health is not the appropriate place to do that. This is all recommendations that have come from Katie and Katie's work on this and what is usual and customary. All social workers are not working in the area now. And they're spread across the agency. So it's important to have that understanding. Do you have it? Do you guys have it?
The 3-1.
Oh, it's on, okay.
Is that what it is?
Yes.
I just pulled it up on my email. Yep, 3.4.
Cause this says November 15th, they do it by November.
It says November.
Convene it by November 15th.
Is November 15th too late for this
It
date?
seems like it's too late.
Yeah, I think,
That's what the draft says.
yeah, I see it. Yeah,
Yeah.
now I see it. I didn't see it before.
Yeah, so I think that's too, I think September 1st.
You want to do September 1st, Lynn?
That is absolutely fine with me. Thank you.
All right, let's do that. That's an organizational meeting anyway, the first one. And there's nothing that precludes your meeting earlier.
That will be the goal.
Okay. Anything else there, committee? I think this is what the social workers have asked for, and I'm happy to put it in for. Okay, but we're good.
Wonderful. Thank you very much.
Well, thank you, and thanks for being here. So briefly before we
Thanks.
quit, the guidelines language now has included the Vermont Criminal Justice Council above in the first section, so look at that. I think we're really close with this bill, if we can, do it. We've got 187, 189, that we could probably do. So we'll go offline, I guess. Some other questions, comments.